Today, we're focusing on antepartum care, which is the care provided to women during pregnancy before labor begins. This period is critical for monitoring the health of both the mother and the baby to ensure a safe and healthy pregnancy. Antepartum care is all about supporting the pregnant woman from conception right up until labor begins. It's not just medical and nursing care. It also takes into account the physical, emotional, and social needs of the woman herself. At the same time, it considers the well-being of the unborn child, her partner, and even other family members. This holistic approach ensures that everyone involved receives the attention and support they need throughout the pregnancy. On this slide, we're looking at different classifications of pregnancy. First, we have the term gravida, which refers to the total number of times a woman has been pregnant, regardless of how far along the pregnancy was. Next, a primigravida is a woman who is pregnant for the very first time. Finally, a multigravida is a woman who is pregnant for the second time or any pregnancy after that. Understanding these terms is crucial when discussing obstetric history and care. On this slide, we're focusing on the classifications of pregnancy based on the number of pregnancies that last more than 20 weeks, regardless of the outcome. First, we have nullipara, which refers to a woman who has never given birth beyond 20 weeks. Then, primipara describes a woman who has given birth once after 20 weeks. Finally, multipara means a woman who has had 2 or more births past this gestational age. It's important to note that in cases of twins or triplets, they are counted as one para, not multiple. This classification helps us understand reproductive history and manage pregnancy care effectively. On this slide, we're looking at the classifications of pregnancy using the TPAL system, which helps us understand different outcomes in pregnancy and birth. TPAL stands for term, preterm, abortions, and living children, giving a comprehensive picture of a woman's obstetric history. We first have the term preterm, which refers to babies born before 37 weeks of gestation. Then, term babies are those born between 37 and 40 weeks. Finally, postterm describes newborns born after 40 weeks of gestation. Understanding these classifications is essential for assessing pregnancy progress and potential risks for both mother and baby. When estimating the date of confinement or the expected delivery date, there are several key methods to consider. First, the fundal height measurement provides a useful guideline. The fundus, or the top of the uterus, is typically above the level of the symphysis between 12 and 14 weeks. By around 20 weeks, it usually reaches the umbilicus or measures about 20 centimeters. After that, it rises approximately 1 centimeter per week until about 36 weeks, though this can vary. One of the classic calculation methods is Naegele's rule, which involves counting back 3 months from the first day of the last menstrual period, then adding 7 days and 1 year to estimate the due date. Ultrasonography is another valuable tool, as it estimates fetal age by measuring the size of the fetal head, providing a more precise gestational age. Finally, fundal height, measured from the top of the symphysis pubis to the top of the fundus using a flexible, non-stretchable tape measure, serves as a gross estimate of gestational age and helps track fetal growth over time. Here, we need to obtain several important pieces of data, starting with the patient's medical history, obstetric history, and details about the current pregnancy. Vital signs are crucial indicators of health, so we closely monitor temperature, which should be between 97 and 100 degrees Fahrenheit. Pulse rate ranging from 60 to 90 beats per minute. respiratory rate from 16 to 24 breaths per minute, and blood pressure, which ideally falls between 90/60 and 140/90 millimeters of mercury. These measurements help us assess the patient's overall condition and spot any potential concerns early on. Now, let's dive into the complete physical examination and the various system changes we need to consider. First, there are cardiorespiratory changes, which can affect heart and lung function. Then, we look at the gastrointestinal system, or GIT, where changes might impact digestion and absorption. Renal system changes are also important because they influence kidney function and waste elimination. Moving on, reproductive changes can affect hormonal balance and reproductive health. Skin changes can be an indicator of underlying conditions or aging. Skeletal changes affect mobility and structural support. And finally, metabolic and endocrine changes impact energy regulation and hormone production. Together, these changes give us a comprehensive picture of the patient's overall health. Now, let's talk about prenatal care and the schedule of visits that are crucial for a healthy pregnancy. Up to 32 weeks, expectant mothers typically have appointments every 4 weeks. Then, as you approach the later stages, from 32 to 36 weeks, visits become more frequent, every 2 weeks, and even more often if any complications arise. Finally, from 36 to 40 weeks, checkups happen weekly to closely monitor both mom and baby as the due date approaches. Regular prenatal visits are essential to catch any issues early and ensure the best possible outcomes. Here, we focus on obtaining crucial laboratory data to support our clinical assessments. Key tests include hemoglobin and hematocrit levels, which help evaluate anemia or blood loss. We also look at white blood cell counts and differentials to detect infections or immune responses. Hemoglobin electrophoresis is important for identifying disorders like sickle cell anemia. Additionally, pap smears and cytology screens are vital for detecting cellular abnormalities, particularly in cervical cancer screening. Antibody screens help us understand immune status, while tuberculin skin testing is used to assess exposure to tuberculosis. Finally, ROAS, blood typing, and urinalysis provide essential information for transfusion compatibility and kidney function. Each of these tests offers unique insights that guide diagnosis and treatment decisions. Now, let's focus on the activities that take place during subsequent visits. These are crucial because they build upon the initial meeting, allowing us to deepen understanding, address any ongoing issues, and ensure continuous progress toward our goals. It's important to maintain consistency and adapt as necessary based on feedback and changing needs. This is an example of an expectant woman/pregnant woman. Now let's check the key indicators that help us monitor maternal and fetal health. First, urine tests are essential for detecting any potential infections or conditions like preeclampsia. Next, tracking weight gain gives us insight into the mother's nutritional status and overall health. Fundal height measurement helps us assess fetal growth by measuring the size of the uterus. Monitoring the fetal heart rate is crucial to ensure the baby is doing well and not in distress. Lastly, focusing on nutrition ensures both mother and baby receive the necessary nutrients for healthy development. Paying attention to these factors allows us to provide the best care possible. Fundal height is a key measurement we use during pregnancy to assess fetal growth and development. It involves measuring the distance from the top of the mother's uterus, called the fundus, to the pubic bone. This measurement helps us estimate the gestational age and monitor the baby's growth over time. By tracking fundal height, we can identify if the baby is growing too slowly or too quickly, which can signal potential health concerns. So, understanding fundal height is essential for ensuring a healthy pregnancy. Here, we're focusing on fundal measurement, which is a crucial part of monitoring pregnancy. This measurement helps us estimate fetal growth and gestational age by measuring the distance from the pubic bone to the top of the uterus. It's a simple, non-invasive method that provides valuable information about the baby's development and helps identify any growth concerns early on. Accurate fundal measurement is essential for ensuring both the mother's and baby's health throughout pregnancy. Regular assessments allow us to track progress and make timely decisions if anything unusual arises. How it is measured. Empty bladder. The patient empties their bladder first to prevent adding 2 to 3 centimeters to the result. Position. The patient lies flat on their back with their head and shoulders slightly supported. Using a tape. A non-elastic tape measure is placed at the top of the pubic bone, symphysis pubis, and stretched up to the highest point of the uterus, the fundus. What the numbers mean. Normal range. After 24 weeks, a measurement that is within 2 centimeters of the current week of pregnancy is normal. Smaller than expected. May point to slow fetal growth, a baby in a breech or lower position, or low amniotic fluid levels. Larger than expected. May point to a multiple pregnancy, like twins, a larger baby, or high amniotic fluid levels. If a measurement deviates by more than 2 to 3 centimeters, a healthcare provider may order an ultrasound to check the baby. Here we see the term fetoscope, which refers to a specialized instrument used to listen to a baby's heartbeat, or a surgical endoscope used to see inside the womb in fetal surgery and diagnosis. It allows doctors to visually examine the developing fetus with great precision. Understanding this tool is crucial because it offers minimally invasive access, improving outcomes for both mother and baby. This technology represents a significant advancement in prenatal care. Here, we're focusing on the fetoscope, a crucial tool used in fetal monitoring. A simple trumpet-shaped wooden or metal tube placed on the mother's belly to manually hear the fetal heartbeat. This device allows healthcare providers to listen to the baby's heartbeat directly, providing essential information about the baby's health during pregnancy and labor. Its simplicity and effectiveness make it a fundamental instrument in prenatal care. Now let's talk about nutrition, which is a crucial part of overall health. First, it's important to assess the diet and watch for signs of malnutrition. From there, we focus on teaching the minimum nutritional increases needed to support well-being. Recording the recommended weight gain helps track progress effectively. Additionally, providing a copy of the daily food guide gives clear guidance on what to eat. Finally, iron supplementation is generally needed to prevent deficiencies and promote good health. Now, we'll focus on fetal and maternal assessment techniques. These are essential methods used to monitor the health and well-being of both the mother and the baby during pregnancy. Understanding these techniques is crucial for early detection of potential complications and ensuring a safe delivery. The assessments can include a variety of approaches, such as ultrasound, fetal heart rate monitoring, and maternal vital sign checks, each providing valuable information about the pregnancy's progress. When we evaluate fetal well-being, one of the key indicators we look at is the fetal heart rate, or FHR. This is typically measured using a Doppler ultrasound transducer placed at the midline of the suprapubic region starting around 10 to 12 weeks of gestation. A normal fetal heart rate ranges from 120 to 160 beats per minute. Another important sign is the phonic souffle, which is a sound caused by blood rushing through the umbilical arteries and is synchronous with the fetal heart rate. In contrast, the uterine souffle results from blood flowing through the uterine vessels and matches the maternal pulse. Recognizing these sounds helps us assess how well the fetus is doing inside the womb. When evaluating fetal well-being, ultrasonography plays a crucial role. It helps us assess gestational age accurately and check for any congenital anomalies. We also use it to investigate cases of vaginal bleeding and to confirm suspected multiple gestations. Additionally, it's essential for monitoring fetal growth and serves as an important adjunct during prenatal testing like amniocentesis or chorionic villus sampling. The transducer placed on the abdomen sends sound waves that create a live image of the fetus on the screen, providing direct and detailed information throughout each trimester. In the first trimester, this imaging is particularly valuable for establishing early fetal health. Now, let's talk about the evaluation of fetal well-being through ultrasonography. During the second trimester, ultrasound is essential for several assessments. We start with determining the gestational age, which helps us track the pregnancy timeline accurately. We also evaluate for congenital anomalies, such as hydrocephaly, to identify any early concerns. Monitoring fetal growth is another critical aspect in this stage. Additionally, ultrasound guides procedures like amniocentesis and fetoscopy, ensuring they are performed safely. We also assess the placental location to detect any issues that might affect delivery and diagnose multiple gestations when twins or more are present. Moving into the third trimester, ultrasound helps us determine the fetal position, which is vital for planning the delivery. We also estimate fetal size to monitor growth and prepare for birth accordingly. Overall, ultrasonography provides comprehensive insights into fetal health throughout pregnancy, supporting both diagnosis and management decisions. When evaluating fetal well-being, ultrasonography plays a crucial role. One important preparation step is that the client should drink fluids before the test to ensure a full bladder, which helps produce clearer images. It's important to note that ultrasonography is non-invasive and has no known harmful effects for either the fetus or the mother. This makes it a safe and effective tool for monitoring fetal health. Now, let's focus on chorionic villus sampling, which is an important method for evaluating fetal well-being. This test is actually the earliest possible one that examines fetal cells as an alternative to amniocentesis. It's used to diagnose fetal karyotype and a range of genetic conditions like sickle cell anemia, PKU, Down syndrome, and Duchenne muscular dystrophy. The procedure is typically performed between 10 and 12 weeks of pregnancy because before 10 weeks, there's a higher risk of limb defects. While it's a valuable diagnostic tool, there are some potential complications to be aware of, including bleeding, spontaneous abortion, and premature rupture of membranes. For race-negative mothers, receiving ROGAM after the test is crucial to prevent a rice isoimmunization. The procedure is done under ultrasound guidance to ensure accuracy, and test results are usually available within 2 to 10 days, allowing for timely decision-making. How the procedure works. Timing. Done during the first trimester, usually at 10 to 13 weeks of gestation. Transcervical approach. A thin tube is guided through the cervix and vagina to the placenta using ultrasound. Transabdominal approach. A thin needle is guided through the mother's abdomen and uterus into the placenta. Sample collection. A small piece of placental tissue, chorionic villi, is removed because it shares the exact same genetic material as the baby. What the test detects: chromosomal disorders, conditions like Down syndrome, trisomy 21, trisomy 18, and trisomy 13. Inherited genetic diseases, single gene conditions such as cystic fibrosis, Tay-Sachs disease, or sickle cell anemia. Note, it does not test for neural tube defects like spina bifida. Risks and considerations. Miscarriage risk carries a small additional risk of pregnancy loss, estimated at about 0.2% to 0.5%. Common side effects. Mild cramping or minor vaginal spotting can occur shortly after the procedure. Advantage: provides definitive genetic answers earlier in pregnancy than an amniocentesis. Amniocentesis is an important procedure used to evaluate fetal well-being by determining fetal maturity and detecting certain birth defects. These include conditions like Down syndrome, spinal bifida, hemolytic disease of the newborn, as well as sex and chromosomal abnormalities. The process involves inserting a needle through the abdominal and uterine walls to aspirate amniotic fluid. This test is usually performed around 16 weeks of pregnancy to assess the L/S ratio, lecithin to sphingomyelin ratio, and identify genetic disorders. But it can be done anytime after 14 weeks. This procedure provides crucial information to help manage the pregnancy effectively. Amniocentesis, a diagnostic procedure used primarily to assess the health of a fetus during pregnancy. This test involves sampling a small amount of the amniotic fluid that surrounds the baby in the womb, which contains fetal cells and various chemicals. By analyzing this fluid, we can detect chromosomal abnormalities, genetic disorders, and certain infections. It's typically performed between the 15th and 20th weeks of pregnancy and is especially recommended when there is a higher risk of genetic conditions. While informative, it's important to understand that amniocentesis carries some risks, including a slight chance of miscarriage, so the decision to proceed should be carefully considered. Amniocentesis is a prenatal procedure used to diagnose certain genetic conditions and infections in the fetus. It involves withdrawing a small amount of amniotic fluid from the sac surrounding the baby, which contains fetal cells and various chemicals. This test is typically performed between the 15th and 20th weeks of pregnancy and can provide valuable information about the baby's health. It's important to understand that while amniocentesis carries some risks, such as miscarriage, it remains a crucial tool for informed decision-making during pregnancy. When evaluating fetal well-being, amniocentesis is an important procedure. Before starting, it's essential that the patient empties her bladder to reduce risks during the process. Ultrasound guidance is used to carefully direct the needle, helping to avoid any trauma to the fetus or placenta. Test results typically take between 2 to 4 weeks. There are some potential complications, including premature labor, infection, and ARISE isoimmunization. After the procedure, monitoring the fetus and uterine contractions is critical. It's also important to instruct the patient to report any decreased fetal movement or increased abdominal discomfort right away. Now let's talk about the evaluation of fetal well-being, specifically focusing on alpha-fetoprotein screening. This test is designed to screen maternal serum for open neural tube defects. Alpha-fetoprotein, or AFP, is a glycoprotein produced by the fetal yolk sac, gastrointestinal tract, and liver. The screening is typically performed between 16 and 18 weeks of gestation. High levels of AFP can indicate serious conditions such as neural tube defects like anencephaly and spina bifida. Additionally, elevated levels may be associated with congenital nephrosis, esophageal atresia, or even fetal demise. This makes AFP screening a critical tool for early detection and management of fetal abnormalities. Now, let's talk about the evaluation of fetal well-being by assessing lung maturity. One key method involves analyzing the amniotic fluid for the presence and amounts of two important lung surfactants, lecithin and sphingomyelin. These substances are crucial because they help the lungs function properly after birth. When the lecithin to sphingomyelin ratio reaches 2 to 1, typically around 35 to 36 weeks of pregnancy, it indicates that the fetal lungs have matured sufficiently. This test can be conducted in a laboratory setting or by simpler methods like the shake test, providing valuable information to guide clinical decisions. Test results and meaning too. 0 or higher, mature lungs, low risk of breathing problems. 1.5 to 1.9, borderline maturity, lungs may be at risk. Less than 1.5, immature lungs, high risk of respiratory distress syndrome. 3.0 or higher, often used as a safer target threshold for pregnancies complicated by diabetes. How the test works. Lecithin, a key lipid component of lung surfactant that sharply increases after 32 to 33 weeks of pregnancy. Sphingomyelin, a lipid component that stays constant throughout the pregnancy. Analysis. Laboratory testing measures the ratio of these two substances via amniotic fluid collection. Now, let's talk about the evaluation of fetal well-being through a procedure called percutaneous umbilical blood sampling. This involves inserting a needle directly into the fetal umbilical cord to collect blood for analysis. The procedure is guided by ultrasound to ensure accuracy and safety. It allows us to screen fetal chromosomes to detect any genetic abnormalities, check for antibodies related to teratogenic viruses, and assess the need for fetal blood transfusions. This technique provides critical information for managing the health of the fetus in complex pregnancies. Now we're focusing on percutaneous umbilical cord sampling, a crucial diagnostic procedure. This technique allows us to obtain a blood sample directly from the umbilical cord, providing valuable information about fetal health. It's minimally invasive and can help in diagnosing genetic conditions, infections, and other fetal disorders with greater accuracy. Understanding this procedure is important for improving prenatal care and outcomes. How the procedure works. Done after the 17th or 18th week of pregnancy. A doctor uses live ultrasound pictures to guide a thin needle through the mother's belly and into the umbilical cord. Results are usually ready in about 3 days. Why it is done? To check for severe fetal anemia or low platelets, to find hidden infections like toxoplasmosis, to test chromosomes when other tests like amniocentesis are unclear, to deliver emergency blood transfusions or medicines to the baby. Risks: bleeding from the umbilical cord site, slowing of the baby's heart rate, risk of infection or miscarriage. Now, let's talk about the evaluation of fetal well-being, specifically through electronic fetal heart monitoring. This technique is used to assess the status of the fetus by tracking changes in the fetal heart rate in response to movements or uterine contractions, whether spontaneous or induced. When we see an increase in the fetal heart rate with movement, it indicates the fetus is receiving adequate oxygen, that the neural pathways to the heart are functioning properly, and the heart can respond appropriately to stimuli. This provides crucial information about fetal health during labor and delivery. How it works. EFM can be performed using external or internal methods. External EFM, most common. Two sensors are secured to your abdomen with elastic belts. One sensor uses Doppler ultrasound to track the baby's heart rate, and the other, a tachydynamometer, records the frequency and duration of contractions. Internal EFM, less common, used only after your water has broken and if more precise readings are required. A small wire electrode is attached directly to the baby's scalp to measure heart rate, and a fluid-filled catheter is inserted into the uterus to measure the exact intensity of contractions. Why it is used? Providers generally recommend continuous EFM if you have a high-risk pregnancy. If labor is induced or assisted with medications like pitocin or an epidural, or if there are any complications during delivery. It is also used during prenatal non-stress tests, NSTs, to check fetal health before labor begins. Now, let's talk about the evaluation of fetal well-being, specifically through the non-stress test. A non-stress test, NST, is a safe, simple prenatal check that measures your baby's heart rate, movement, and responses. It is normally done after 28 to 32 weeks of pregnancy to make sure the fetus gets enough oxygen. Before the test, it's important that the patient eats snacks to help stimulate fetal activity. The key thing we look for in favorable results are at least two fetal heart rate accelerations, each lasting 15 seconds within a 20-minute period, with the heart rate returning to the normal baseline afterward. The non-stress test uses a tachydynamometer to record fetal movements, while a Doppler ultrasound monitors the fetal heart rate, typically after 28 weeks of pregnancy, to ensure the baby is healthy and responsive. This slide focuses on the evaluation of fetal well-being through the contraction stress test. Essentially, this test assesses how the fetus responds to the stress caused by labor contractions. It can be performed using either nipple stimulation or oxytocin stimulation to induce these contractions. Importantly, the test is only done after 28 weeks of pregnancy. During the procedure, the woman is placed in a semi-Fowler's or side-lying position for comfort and safety. We also closely monitor for any signs of labor starting after the test to ensure both mother and baby remain safe throughout. A positive contraction stress result means that there are late decelerations seen with at least 50% of contractions. This indicates potential risks to the fetus and may require a C-section to ensure safety. We refer to this as a positive window. On the other hand, a negative contraction stress result means no late decelerations are observed during at least 3 contractions lasting 40 to 60 seconds within a 10-minute period. This is considered normal and is called a negative window. This test helps us understand how well the fetus is tolerating contractions and guides us in managing the pregnancy's safety. When we talk about evaluating fetal well-being, one commonly used method is called kick counts. This involves the daily recording of fetal movements to assess the baby's active and passive states. The test is simple and non-invasive, usually done while the pregnant woman is lying on her side for comfort. Interpreting the results is crucial. A normal or positive result means the mother feels 3 or more movements within 1 hour. It's important to remember that these movements can vary naturally, especially depending on whether the fetus is asleep or active. On the other hand, an abnormal or negative result is when fewer than 2 movements are felt per hour, especially if there's a noticeable drop from the usual pattern. This situation demands immediate reporting to a healthcare provider and might lead to scheduling a non-stress test, or NST, to monitor the fetus more closely. So, tracking fetal activity through kick counts is a vital way to help ensure the baby's health throughout pregnancy. Now, let's discuss the evaluation of fetal well-being, which is crucial for monitoring the health of the baby during pregnancy. This evaluation is based on 5 key categories. These include the non-stress test, which observes the baby's heart rate response, the amniotic fluid index, which measures the amount of amniotic fluid, fetal breathing movements, which show how well the baby is practicing for life outside the womb, fetal tone, indicating muscle activity, and a reactive heart rate, demonstrating the baby's responsiveness. Each of these categories is scored with a value of 2 points, and the total score is used by physicians to assess fetal health. Scores from 8 to 10 are considered reassuring, suggesting the baby is doing well. This combined assessment is known as the biophysical profile, a comprehensive way to ensure fetal well-being. Here, we focus on psychosocial development, which involves the growth of an individual's social relationships and emotional well-being throughout life. This concept highlights how our interactions with others and our sense of self evolve as we face different social challenges and stages, especially during pregnancy. During the first trimester, many women experience ambivalence, fear, fantasies, and anxiety as they process the news of their pregnancy. At this stage, the pregnant woman tends to focus primarily on herself, adjusting to the new reality. Moving into the second trimester, there is typically a more tranquil period. This phase is marked by an acceptance of the pregnancy, and the mother's interest in the fetus begins to grow significantly. By the third trimester, women start to anticipate labor and delivery and begin to assume the mothering role. It's also common to have vivid fantasies and dreams about labor, along with nestling behaviors as they prepare for the baby's arrival. These adaptations highlight the evolving emotional and psychological journey throughout pregnancy. On this slide, we're focusing on the key developmental tasks of pregnancy. The first important step is the realization, I am pregnant, which involves accepting the biological fact that pregnancy is happening. Then comes the recognition, I am going to have a baby, where the mother begins to see the fetus as a separate individual who needs care and attention. Finally, the task shifts to, I am going to be a mother, where preparations are made, both mentally and practically, to realistically welcome the birth and take on the responsibilities of parenting. Each of these stages reflects a deeper emotional and psychological adjustment that's crucial for a healthy pregnancy experience. Let's talk about the danger signs of pregnancy that require immediate attention. First, any bleeding from the vagina is a serious warning sign. Also, if there is a gush of fluid, clear and not urine, coming from the vagina, it could indicate that the water has broken prematurely. Regular contractions before the due date are another critical sign to watch for. Severe headaches or sudden changes in vision can suggest complications like preeclampsia, so these need to be reported right away. Epigastric pain, which is pain in the upper abdomen, is also concerning. Persistent and severe vomiting can lead to dehydration and needs prompt care. Additionally, a noticeable change in fetal activity, whether a decrease or an unusual pattern, should not be ignored. If there is a temperature elevation along with chills or a general feeling of being unwell, it could signal infection. Finally, swelling in the upper body, especially in the face and fingers, is another symptom that could indicate preeclampsia and must be checked by a healthcare professional. Recognizing and responding to these signs can make a significant difference in the health of both mother and baby. On this slide, we focus on markers in fetal development, which are crucial indicators to track how the fetus is growing and maturing. These markers help us understand the progress of different organ systems and identify any potential concerns early on. By monitoring these key points during pregnancy, we can ensure the best possible outcomes for both the baby and the mother. Here we have a key timeline milestone, 1 month. This represents a crucial point in our project, marking significant progress and a moment to evaluate our initial outcomes. Keeping a close eye on this 1 month mark helps ensure we stay on track and make any necessary adjustments early on. Here we see a timeline marked by 2 months. This likely represents a key duration for a project phase or a deadline. Understanding this time frame is crucial for managing expectations and planning next steps effectively. Let's keep this period in mind as we move forward. At 8 weeks of fetal development, several crucial changes are happening. The ears begin to form, marking the start of the baby's ability to eventually hear. There's significant growth in the limbs, brain, and facial features, shaping the baby's overall appearance. The heart, a vital organ, starts to pump blood, ensuring circulation throughout the tiny body. At this stage, the fetus weighs about 2 grams, and even tiny muscles are beginning to develop, setting the foundation for movement later on. These markers highlight the rapid progress occurring just 2 months after conception. On this slide, we're focusing on the key maternal changes during early pregnancy. One of the most common symptoms is the persistence of nausea and vomiting, which can be quite challenging for many women. At the same time, the uterus undergoes a physical transformation, changing from its usual pear shape to a more globular form. Another important change is the increase in leukorrhea, which is a type of vaginal discharge, often more noticeable during pregnancy. Emotionally, ambivalence is often noted, reflecting the mixed feelings many women experience during this time. Interestingly, despite all these changes, there may be no noticeable weight gain yet. Our overall goal here is to focus on preventing nausea when possible, ensuring safety, and preparing both physically and mentally for a healthy pregnancy. Here, we're focusing on a period of 3 months. This time frame is crucial for setting goals, tracking progress, or implementing strategies, depending on the context of our project. It's long enough to see meaningful results, but short enough to stay agile and make adjustments as needed. Let's keep this period in mind as we move forward. At 9 to 12 weeks of fetal development, several important markers emerge that indicate key progress in growth. One of these is the transparency of the heart, as seen on ultrasound, which helps us monitor cardiac development. The fetus typically weighs between 19 to 28 grams at this stage, showing significant growth from earlier phases. This period also marks the transition from embryo to fetus, accompanied by the development of the lower body. The kidneys become very productive, starting to function in important ways. Additionally, evidence of sex development begins to appear, setting the foundation for further differentiation. These markers are crucial in tracking a healthy pregnancy. In continuation, some important maternal changes during pregnancy. First, the uterus rises above the pelvic brim, which is a key physical change. You may also notice Braxton Hicks contractions. These are mild, irregular contractions that are normal and help prepare the body for labor. Another important point is the increased potential for urinary tract infections, or UTIs, so prevention is critical here. We typically see weight gain of about 2.5 to 4 pounds during the first trimester. By this time, the placenta is fully functioning and producing hormones essential for maintaining pregnancy. Our goal today is to cover how to prevent UTIs, discuss proper nutrition and exercise, and also explore how pregnancy can affect the sexual relationship. This phase is set to last for exactly 4 months, which is crucial for achieving our project milestones on time. During this period, we'll focus on completing all key tasks efficiently and maintaining steady progress. It's important that we stay on track to meet our overall timeline goals. This phase is expected to last for 5 months, which allows us enough time to thoroughly complete all the necessary tasks and ensure quality results. During this period, we'll be closely monitoring progress and making any adjustments needed to stay on track. At 17 to 20 weeks of fetal development, several key markers stand out. Touch becomes crucial during this stage as the fetus starts responding to sensory input. The average weight ranges between 200 to 400 grams, showing significant growth. Eyebrows begin to form, which is an important physical milestone. Additionally, the vernix, a protective layer, starts to develop on the skin. At this point, the fetus exhibits total body functioning, meaning all the major systems are operational. Lastly, fine hair known as lanugo appears, covering the body and providing warmth. All these changes reflect the rapid and intricate development taking place in this period. As the pregnancy progresses, several maternal changes take place that are important to recognize. The fundus, or the top of the uterus, reaches the level of the umbilicus, which is a key indicator of fetal growth. Around this time, the breasts start secreting colostrum, the first form of milk, and the areola becomes darker. The amniotic sac holds approximately 400 milliliters of fluid, providing a protective environment for the baby. Many women may experience postural hypotension, which is a drop in blood pressure when standing up, so it's important to change positions slowly. Fetal movements become noticeable, which is an exciting milestone. Nasal stuffiness often begins due to increased blood flow and hormone changes, and leg cramps may occur, adding some discomfort. Varicose veins might develop due to increased pressure on the veins. Constipation is also common and can be particularly bothersome, so our goal is to teach effective comfort measures to help manage these symptoms, and especially to avoid constipation for better overall well-being. Here, we are focusing on a time frame of 6 months. This period is crucial for tracking progress and making any necessary adjustments to ensure success. Over these 6 months, we can expect to see significant developments and measurable outcomes that will guide our next steps. Here we have a clear timeline marker indicating a period of 7 months. This duration is crucial because it sets the stage for the progress and developments we've been tracking. Understanding this 7 months time frame allows us to measure growth, identify key milestones, and assess the impact of our strategies within a realistic period. It's important to keep this timeline in mind as we move forward and analyze the outcomes tied to this specific span of time. At 26 to 28 weeks, there are several important milestones in fetal development. The fetus weighs about 1100 grams or 2.5 pounds, and the eyelids open for the first time. Around this period, normal lung surfactant is formed, which is crucial for breathing after birth. The baby's young hair becomes abundant, and hearing is now possible. For the mother, this stage often brings increasing heartburn and total discomfort. It's important to manage symptoms like hemorrhoids and encourage discussions about labor and delivery. Adequate rest is also vital during this time, and the fetus will have a clear, good outline on ultrasounds. This period is critical as both mother and baby prepare for the final stages of pregnancy. At this stage, we observe several important maternal changes. The fundus has risen to about halfway between the umbilicus and the xiphoid process, indicating significant uterine growth. Breathing shifts to a more thoracic pattern as the diaphragm becomes restricted. The woman often feels tired and is understandably eager to deliver soon. Heartburn is a common discomfort now, and hemorrhoids may develop due to increased pressure. Our goals are to effectively treat hemorrhoids, teach comfort measures, and provide guidance on avoiding heartburn. Additionally, we focus on preparing both the mother and family for the upcoming delivery and parenthood. Here we see the timeline of 8 months, which marks the duration of our project phase. This period is crucial as it sets the foundation for our next steps and ensures that all key milestones are met within this time frame. Staying on schedule during these 8 months is essential for the overall success of the project. It allows us to allocate resources effectively and maintain momentum throughout the process. Keeping this timeline in focus will help us stay aligned with our goals and expectations. Here we see the time frame of 9 months, which is crucial for understanding the duration of this project phase. This period allows enough time to plan, execute, and review the necessary steps to achieve our goals. It's important to keep this timeline in mind as we move forward to ensure we stay on track and meet our deadlines. At 30 to 32 weeks of fetal development, there are several important markers we need to keep in mind. The fetus typically measures around 15 to 17 inches in height and weighs between 1800 to 2200 grams. At this stage, it's crucial to teach measures to reduce edema, since swelling can be a concern for the mother. We also want to emphasize the importance of rest periods to help manage her energy levels. It's essential to review the signs of labor with the mother so she knows when to seek medical attention. Comfort measures should be taught as well, which can include things like proper positioning and relaxation techniques. Since the baby is growing rapidly, advising proper storage of calcium and iron is key to support both maternal and fetal health. Lastly, watch for any breast tenderness the mother may experience, as it can indicate hormonal changes as the body prepares for childbirth. Overall, this period is about ensuring the mother is well informed and comfortable as she approaches the final weeks of pregnancy. As pregnancy progresses, several maternal changes become quite noticeable. The breasts often become full and tender, which is a common experience. You may also find that urinary frequency returns, which can be inconvenient but is typical. Swollen ankles can occur, so it's important to manage this symptom carefully. Additionally, some women may develop sleeping problems and even experience shortness of breath or dyspnea. Our goal here is to decrease edema by teaching effective comfort measures and preparing for childbirth to ensure the best possible experience. Here, we see a timeline of 10 months. This period is crucial as it represents the time frame within which key milestones and objectives are expected to be achieved. Understanding this duration helps us plan effectively and track progress throughout the project. At full term, between 38 to 40 weeks, the average fetus measures about 360 millimeters in length and weighs between 3,400 to 3,600 grams. The skin is smooth, indicating maturity, and the fetus has built immunity that will protect it for the first 6 months after birth. The mother's activity is usually limited at this stage to ensure safety. The chest appears prominent, and you might notice lightening, which means the baby has moved lower into the pelvis in preparation for birth. The eyes of the fetus are uniformly slate-colored by this time, and bone ossification is actively progressing, strengthening the skeletal structure. The skull sutures are nearly together, but remain flexible to allow for passage through the birth canal. For male fetuses, the testes have descended into the scrotum, signaling readiness for delivery. Overall, these markers collectively show that the fetus is well prepared for labor and delivery. On this slide, we focus on key maternal changes during pregnancy, especially as the body gets ready for labor. First, the placenta weighs approximately 20 ounces, playing a crucial role in supporting the baby. Many mothers experience a burst of energy right before labor begins. At the same time, discomforts like backache tend to increase, and urinary frequency becomes more common. Meanwhile, important physical changes are happening internally. The cervix and the uterine segment are preparing for labor. Our goal here is to emphasize teaching safety measures for delivery, ensuring both mother and baby remain healthy throughout this critical time. Let's talk about some of the common discomforts of pregnancy that many women experience. These can range from mild symptoms like nausea and fatigue to more uncomfortable issues such as back pain and swelling. Understanding these discomforts helps us manage them better and ensures a healthier pregnancy journey. Recognizing that these symptoms are normal can provide reassurance and guide us toward effective solutions. It's important to stay informed and consult healthcare providers when needed to maintain both physical and emotional well-being during this time. One common discomfort during pregnancy is ankle edema, or swelling in the ankles. To help relieve this, it's important to rest with your feet elevated whenever possible. Avoid standing for long periods, as this can increase swelling. Also, steer clear of restrictive garments on the lower half of your body, since they can impede circulation and make the swelling worse. These simple measures can make a big difference in managing discomfort. Now let's talk about how to relieve the common discomforts of pregnancy, specifically focusing on backache. One effective way is through gentle exercises like tailor sitting, pelvic rocking, and shoulder circling, which help strengthen the back muscles. Applying local heat can also provide soothing relief. It's important to avoid standing for long periods, as this can increase strain on your back. When picking up objects, remember to stoop rather than bend awkwardly to protect your spine. Wearing low-heeled shoes supports better posture, which is key, and always aim to keep your shoulders and neck straight to maintain proper alignment and reduce tension. These simple steps can make a big difference in easing back discomfort during pregnancy. One common discomfort during pregnancy is breast tenderness. To help relieve this, wearing a supportive bra can provide comfort and reduce pain. Additionally, it's important to decrease the amount of caffeine and carbonated beverages you consume, as these can sometimes worsen discomfort. Making these simple changes can make a noticeable difference in how you feel. Let's talk about relieving constipation, which is a common discomfort during pregnancy. First, increasing fiber in your diet is crucial because it helps keep your digestive system moving smoothly. Drinking plenty of fluids, ideally 8 glasses of water a day, also plays a big role in preventing and easing constipation. It's also important to maintain a regular time for bowel movements to help your body establish a comfortable routine. On the other hand, try to limit cheese consumption, as it can worsen constipation, and avoid sweets since they promote bacterial growth in your intestines, causing gas and bloating. Taking these steps can make a significant difference in managing constipation during pregnancy. Pregnancy often comes with its share of discomforts, and one common challenge many expectant mothers face is difficulty sleeping. To help ease this, drinking a warm caffeine-free beverage before bedtime can be very soothing. Additionally, practicing relaxation techniques like deep breathing or gentle stretching can promote better rest and comfort during the night. Pregnancy often brings common discomforts, and one of the most frequent is fatigue. To help relieve this, it's important to schedule rest periods throughout the day so your body can recharge. Establishing a regular bedtime routine also promotes better sleep quality, which can reduce tiredness. Additionally, using an extra pillow can provide more comfort and support, making it easier to rest and relax during this time. Remember, prioritizing rest is key to managing pregnancy fatigue effectively. Pregnancy often comes with some common discomforts, and today I want to focus on how to relieve faintness. First, it's important to move slowly to avoid dizziness or sudden drops in blood pressure. Second, avoid crowds, as they can make you feel overwhelmed or overheated. Staying in a cool environment helps regulate your body temperature, which is crucial. Finally, when you're resting, lying on your left side improves blood flow and can reduce feelings of faintness. These simple steps can really make a difference in your comfort during pregnancy. Pregnancy can bring about a lot of discomforts, and headaches are a common one. To help relieve this, it's important to avoid eye strain, which can often trigger or worsen headaches. Make sure to visit your eye doctor if you notice changes in your vision or if headaches persist. Resting with a cool cloth on your forehead can soothe the pain and provide relief. For managing the pain, you can take Tylenol in a regular adult dose as needed. However, if you experience frequent or persistent headaches, it's crucial to report these to your primary care provider to rule out any serious concerns. Taking these steps can make a big difference in managing headaches during pregnancy. During pregnancy, many women experience heartburn, which can be quite uncomfortable. To help relieve this, it's important to eat small, frequent meals throughout the day rather than large ones. Avoiding overeating and steering clear of spicy, fatty, and fried foods can significantly reduce the chances of heartburn. These simple dietary changes can make a big difference in managing this common pregnancy discomfort. When dealing with hemorrhoids during pregnancy, it's important to focus on relieving discomfort in practical ways. First, avoid constipation and straining during bowel movements, as this can worsen the problem. Taking a sitz bath can provide soothing relief by gently cleansing and reducing inflammation. Additionally, applying a witch hazel compress helps calm irritation and shrink swollen veins. These simple steps can make a significant difference in managing hemorrhoids comfortably. One common discomfort during pregnancy is leg cramps. To help relieve them, it's important to avoid pointing your toes. Instead, straighten your leg and gently dorsiflex the ankle. That means pulling the toes up toward the shin. This simple stretch can ease the cramp and provide some much-needed relief. Let's talk about relieving the common discomfort of nausea during pregnancy. One effective strategy is to eat 6 small meals a day instead of 3 large ones. This helps keep stomach settled and blood sugar more stable. Also, try eating a piece of dry toast or some crackers before getting out of bed in the morning, which can help reduce that morning queasiness. It's important to avoid foods or situations that make nausea worse. If nausea persists or becomes severe, make sure to inform primary care provider. Drinking fluids separately from meals can also help prevent feeling too full or queasy. Lastly, steering clear of fried, greasy, gas-producing spicy foods and anything with strong odors that might trigger nausea. These simple changes can make a big difference in managing this common discomfort. One common discomfort during pregnancy is nasal stuffiness, which can be quite bothersome. To relieve this, use a cool air vaporizer or a humidifier to add moisture to the air, which helps ease breathing. Increasing fluid intake also keeps the mucous membranes hydrated. Another helpful tip is to place a moist towel over sinuses or gently massage them to reduce congestion. These simple steps can make breathing more comfortable during pregnancy. One common discomfort during pregnancy is round ligament pain. To help relieve this, it's important to avoid twisting motions, which can aggravate the pain. When rising to a standing position, do so slowly and use hands to support your abdomen. Additionally, bending forward gently can help ease the discomfort. These simple adjustments can make a significant difference in managing this common pregnancy ache. One helpful way to relieve common pregnancy discomforts is to use proper posture throughout the day. This can reduce strain and help feel more comfortable. At night, placing pillows behind head and shoulders can also provide support and ease any tension. Another common issue many expectant mothers experience is shortness of breath, which is important to manage with these simple adjustments. One common discomfort during pregnancy is urinary frequency, which means needing to urinate more often. To help manage this, it's important to void as necessary, ideally at least every 2 hours, to avoid any discomfort or infections. Increasing fluid intake will also keep well hydrated, but try to avoid caffeine since it can irritate the bladder. Additionally, practicing Kegel exercises can strengthen the pelvic floor muscles and provide better control, making it easier to handle this common issue. When it comes to relieving the common discomforts of pregnancy, there are some simple yet effective practices to keep in mind. First, wearing cotton underwear helps maintain comfort and breathability, which is crucial during this time. Bathing daily not only keeps you clean, but also promotes overall well-being. It's also important to avoid tight pantyhose, as they can restrict circulation and increase discomfort. These steps are especially helpful in managing vaginal discharge, which is a normal part of pregnancy, but can sometimes cause irritation. Keeping things clean and comfortable makes a big difference. During pregnancy, many women experience discomfort due to varicose veins, which are swollen, twisted veins usually appearing in the legs. To help relieve these common discomforts, it's important to walk regularly to promote circulation. Also, resting with feet elevated can reduce swelling and ease pressure on veins. It's best to avoid standing for long periods and to never cross legs when sitting, as these positions can worsen vein issues. Additionally, avoid knee-high stockings and instead opt for support hosiery, which can provide better overall support and comfort. These simple steps can make a significant difference in managing pregnancy-related varicose veins. When we talk about weight gain during pregnancy, it's important to understand where that weight is coming from. In the first half of pregnancy, most of the gain reflects maternal tissue, like increased blood volume and fat stores. In the second half, the majority of the weight gain is due to fetal tissue growth. Generally, a total weight gain of 24 to 30 pounds is recommended. This gain isn't uniform throughout pregnancy. In the first trimester, weight gain is usually modest, about 2 to 4 pounds. Then, during the second trimester, it increases more significantly, around 11 to 14 pounds. Finally, in the third trimester, the recommended gain is 8 to 11 pounds, which averages out to about half a pound per week. This pattern supports healthy development and prepares the body for childbirth. Anemia is a condition that occurs when your body doesn't have enough healthy red blood cells, often due to iron deficiency. To help prevent or treat anemia, it's important to increase intake of iron-rich foods. These include fish and dairy products, cereals and yellow vegetables, green leafy vegetables, and citrus fruits, as well as egg yolks and dried fruits. Incorporating a variety of these foods into diet can significantly improve iron levels and overall health. Here we focus on vitamin deficiency and how to address it effectively. One key approach is to increase intake of vitamins, which is essential for overall health. Specifically, calcium intake should be increased, especially for pregnant women. In fact, it's recommended that pregnant women drink 1 quart of milk per day to meet their calcium needs and support both their own health and the development of the baby. This simple dietary adjustment can make a significant difference. Malnutrition can be addressed effectively by ensuring a balanced diet that includes all essential food groups. It's important to have 4 servings from the dairy group to provide necessary calcium and vitamins. Along with that, 3 servings of protein are vital for muscle repair and overall body function. Vegetables should make up 2 servings, offering fiber and important nutrients. Carbohydrates, which are our main energy source, should be included in 4 servings. Finally, 2 servings of fruits help supply vitamins, minerals, and antioxidants. Balancing these servings helps combat malnutrition and promotes overall health. Thank you all for listening and being part of this session. I appreciate your time and attention. If you have any questions or want to discuss anything further, I'm here to help.